Dr. Ohm, you explained to us that that was a misaligning of the vertebrae, and that can cause several problems. My question is there a connection between birth trauma and sudden infant death syndrome, which we all refer to as SIDS? Dr. Ohm?
Well, there was a study done back in late 60s, early 70s by an Abraham Tobin, an MD, and the study was called Spinal Injury Related to the Syndrome of Sudden Infant Death, crib death in infants.
Yes.
And what he noticed on autopsy, 7 out of 8 of the children that he did autopsy who had died from SIDS had subdural hemorrhaging that was of the spinal cord, right here at the top. How many? 7 out of 8 of those that he did. And it seems to me, now the American Academy of Pediatrics is telling us to lie children on their back will prevent SIDS. And whereas mostly when our older guys were being raised, we were told to lie them on their stomach and turn the head this way or that way. Sure. Now they're saying that that can increase the chance of SIDS. Well, look what happens when you turn your head this way or that way. You're turning right here at the brain stem area where the respiratory centers are. Okay. Okay, so if you put a child on its back, there's less apt to cause more injury to this perhaps already damaged area. And his studies are showing that there is significant damage, not just in forceps deliveries, but also in your normal natural delivery process can be traumatic to the child, especially if there's any pulling, even if it's slight pulling. As I had said before, just to pull a bit on this little tiny spine can be traumatic and stretch that spine more than it needs to, the spinal cord. So now you take that injured spine or that spinal cord and you turn it one way or another, and you're going to add insult to the injury. So I believe...
You were making some comments before the break, Jean, that you feel that there is, Dr. Ohm, that there is a connection. Dr. Larkin, would you have any opposing views and opinions on that you'd like to address?
Yes. First of all, I'd just like to explain what SIDS is. That is a condition of sleep apnea where a baby is laid to sleep and then suddenly just stops breathing for no apparent reason. A basically healthy baby just stops breathing. And there have been many studies on SIDS throughout the years, and in fact, as to date, it is basically multifactorial. There are many things that can cause a baby to stop breathing. One of them is prematurity. That is a well-known connecting factor. Another one is drug use. It has been a positive correlation between mothers who have been heroin abusers. They have a higher incidence of SIDS. Right. And more recently, like I said, there are many, but more recently, the more interesting one is a study connected with lack of neurotransmitters. There's a large study done on children of SIDS who died, and they found that the majority of them lacked a neurotransmitter receptor for carbon dioxide, but yet not all of them. And what I mean by a receptor, when we breathe in oxygen, and when we exhale, our body signals, the oxygen is converted to carbon dioxide, and after we build up a certain level, we exhale, or if the levels become even very high, we yawn. Okay. And so what happens is they found that these babies, they lack this receptor, okay, for the carbon dioxide, and they don't sense the high levels of carbon dioxide, and they stop breathing. They don't exhale, and then they no longer inhale. But like, it's multifactorial, and I think it's a little premature to make that statement that SIDS is connected to childbirth trauma. I don't doubt that there may be SIDS death that are connected.
You just feel that there are other factors?
There are other factors that could be that are involved.
Dr. Ohm, I got to come back to you. It's a question I must ask you. You've talked about the connection between childbirth traumas and problems that may be associated with that child's life as they continue to live, and you enumerated what they are. How do you respond to a doctor, medical doctor, trained in the system, who watches this show and sees and hears you, here's Dr. Jean Ohm, a chiropractor, make comments about what's affecting, you know, long-term effects, etc., etc. How do you respond to him who says you have no medical justification and verification for the comment that you made? Respond to that.
All my verification comes from medical studies. The first study that I mentioned, by Abraham Tobin, spinal injury related to SIDS, latent spinal cord and brainstem injury in newborn infants, is another major study he did, saying the birth process, even under optimal controlled conditions, is potentially a traumatic, crippling event for the fetus. During active labor, the spinal column, particularly the cervical portion, may be injured as the fetus is compressed and forced down the birth canal. And he's not even talking then about the pulling that happens with that.
That reference was again?
That was Abraham Tobin.
A medical doctor.
A medical doctor, sure.
Not a chiropractor.
Oh, no. Then we have David Yashan, MD, spinal injury of newborn infants, okay, and his reports on that. Birth injury to the cervical spine and spinal cord by Helen Reed. These are all peer-reviewed. These have been published in medical journals, which I read. Kinematic imbalances due to suboccipital strain in newborns, okay? So the only experience that they have been through is the birth process. Long-term prognosis for the infant with severe birth trauma. Immediate management of the traumatized infant. Spinal cord birth injury. Value of computed tomographic,
Okay, I mean, so you have the documentation.
Absolutely.
So your response is?
My response is that I'm using medical data to state what we are seeing as chiropractors, to know what is traumatizing these children, that what's happening to them, that at 3 months of age, this area of their brainstem is being so damaged that shows up on autopsy. Or maybe not even so damaged to kill them, but enough to make them chronically ill. And when we do a very light, simple chiropractic adjustment to the upper cervical portion of their neck, they get well.
They get well.
They no longer have ear infections. They no longer have, their body begins to strengthen and heal itself.
How young are we talking in children?
Well, how young do I check children? As soon as they're born. And to make sure that the natural trauma, hasn't injured the spinal column, and certainly if there's been trauma at birth, an invasive procedure like forceps or even just regular twisting and pulling.
Once again, how early can you see problems showing up in infants?
You can see them several weeks. Symptoms may start showing where a child is colicky, or a child begins to get repeated ear infections, or they begin to have asthma starting about 3-4 months of age, or allergies, and they're going in and there's, we don't know why your child has this, but these children, when they start getting adjusted, they're again, the interference to their nervous system is removed, and their whole body can function in a greater state of health.